Thank you for having me. Excited to talk about this today with you. So I'm Angela Lancaster. I'm a LCSW. I've been in private practice since about 2018, and I'm specializing in trauma, attachment trauma, and all the related types of symptoms that one might present with, even if they don't know that it's related to traumas, anxiety, depression, relationship issues. I am certified in EMDR through IMDRIA. And I also am IFS informed, internal family systems. I've been trained in several different versions of IFS. I haven't gone through the actual IFS Institute level one training, but I've done a lot of the other trainings with trainers who have certifications in IFS and specifically on how to integrate IFS with EMDR. I'm also ketamine-assisted psychotherapy certified, which works great alongside EMDR and IFS. And yeah, integrate other modalities like polyvagal theory and somatic therapy just to kind of hit all the necessary avenues for helping people heal. That's a little bit about me.
How do you usually combine ketamine and EMDR in your practice?
There's a couple different ways to do that. There's the psycholytic dose of ketamine, where the client can actually come in on a low dose of ketamine for therapy sessions, and they're still present and able to have conversations, so they're not in a completely altered state of consciousness, but their like defenses are a little bit lower, which allows work that you're trying to do with EMDR to just flow a little bit easier. It's been described as they have like the safety blanket on with the low dose ketamine that allows them to a little bit deeper into things that they might want to explore, whether that's resource development, whether it's, going back and connecting with a part of themselves that they want to, that holds a lot of memories or pain or distress associated with past experiences. And you're using the EMDR to, as normal with standard protocol, to facilitate memory reprocessing under the psycholytic dose. For the more psychedelic dose of ketamine, typically it will be, you can be sitting in with the client while they are under the influence of the medicine. And you're typically just there to provide support, provide safety for them. If anything does come up, you're just there to make sure that they know that they're not alone, you're there with them. You're not really doing a lot of reprocessing during the psychedelic experience, but you're just there to provide that safe container. Works really well if you already have an established relationship with the client and they desire someone there that knows their history and knows a little bit about them and would be able to provide that safe container. The goal would be doing more of the integration work either within 24 to 48 hours after the psychedelic experience. They might come back in to the office and see you for an actual EMDR session where they would get to integrate some of the information that came up during the psychedelic experience. You might be doing some gentle guidance for them in terms of really allowing their own inner healer to show up while they're in a different state of consciousness with the medicine. Some therapists will do, like if they are having an experience in the psychedelic dose, might have the bilateral stimulation therapists who have wristbands that the client will wear. So if something comes up and they are wanting to maybe enhance a connection with a internal resource like their inner healer, just to help integrate that as a connection that as a resource that the client is experiencing that moment. Or if a really difficult issue does come up then they might add some of the faster BLS to just help that move through a little bit easier, while also offering some of those just safety and the reassurance of, you're not alone, I'm here with you. This is just stuff that's coming up. It's not happening right now. Some of those like interweaves that you might use just to help them feel safe and calm as they're processing whatever is coming up.
How does EMDR compare to other somatic types of healing modalities? How is it different?
It is considered a somatic therapy because the body is very important, and we're always looking at how trauma is held in the body and in the nervous system. That's something that was integrated as part of EMDR. I think maybe one of the differences is that it is structured, and it's more of a hybrid where it's looking at the bodies, it's looking at somatic experience of the memory or the trauma, and how it's stored in the body, but it's also looking at the emotions and the cognitions that go with that. And it's very targeted on the memory itself. We're memory focused in the sense of what we want to resolve how that whatever is stored somatically in the body, where it connects to a memory in the past so that that can be released. And then the body and the mind can kind of integrate all those elements of a new belief about themselves, a new feeling about themselves and the world, and the somatic relaxation and release that comes with that adaptive information being developed through EMDR.
It's like putting the files where they go. The
Yes.
the usual cue for me is that was then, this is now. What is your analogy for it?
Yeah, that filing cabinet analogy is a really good one to understand the adaptive information processing theory that EMDR is based on. The idea that when we have an upsetting experience, typically our brain is able to process that experience as, oh, that happened, but I'm safe and I'm okay now, and it files it away effectively. When we have chronic trauma or upsetting experiences that are too overwhelming for the brain to process, it kind of sits in that filing cabinet and gets stuck in this raw sensory experience with maybe schemas or core beliefs that get attached to it. The EMDR, the bilateral, is helping the brain. People have compared it to replicating what we experience in REM sleep. So, we go to sleep at night and our eyes are moving back and forth as they would involuntarily during deep sleep. That's our brain actually being able to process information and store it away effectively. The bilateral eye movements or tapping or sounds replicate that REM sleep, where the brain gets to kind of integrate the information and move it through so that it gets unstuck, where it might be sort of frozen in time at the time that trauma happened, and allows it to be stored more adaptively.
How is it different to go to a regular therapist versus going for EMDR therapy?
I think when we're thinking about like, okay, we've got a client coming in who's just completely overwhelmed, right? We use this concept of the window of tolerance a lot to talk about. In order to do effective EMDR, we have to help the client stay in their window of tolerance. If we've got a client who's either stuck in hyperarousal or stuck in hypoarousal, we're kind of cycling through both of them pretty frequently and doesn't spend a lot of time in their window, we really have to help them widen that window first before we go to any past experiences that might be contributing to them feeling the way that they're feeling, kind of like a dumpster fire. My life is a dumpster fire. Everything's kind of, the house is burning down around me. We're going to really work at developing resources for the client to help them widen that window. I like to think about it in the sense of a person who comes in and maybe has gone through a difficult breakup or a difficult divorce, relationship issue, but they have a pretty healthy nervous system. They had their needs met pretty consistently. They had caregivers who were attuned and supportive and validated their feelings and their needs, come in because this was a really upsetting experience for them. And they're going to be able to pretty easily access the adaptive information that's going to be needed to help them recover from this breakup or divorce, right? This attachment rupture that happened in the present. Someone who didn't have those caregivers who were consistently there, even maybe went so far as not just not meeting those needs, but also then shamed them or blamed them for having those needs, they're going to have a much more difficult time recovering from an attachment rupture in the present, because it's going to be triggering for all of those core beliefs that got attached to not having those early needs met. I'm unlovable, or I'm too much, or not enough. I can't trust anyone. No one's there for me, so I've got to take care of myself. Those types of things that get triggered by present day experiences, because they are missing a lot of that adaptive information that's going to be necessary to help them integrate this experience into their life in an adaptive way. We have to really start with the preparation phase and doing a lot of resourcing. That's where parts work can be really helpful. In this case, we're talking more about those people who have complex trauma that means that they are pervasively been traumatized or had overwhelming experiences of those needs not being met, or abuse early in life. They might not have any experience of having their needs being validated or feeling safe to have feelings or needs in the first place. We spend a lot of time in the beginning really helping them develop some of that adaptive information. This is where parts work with EMDR becomes really helpful, because we help those clients who typically are very critical and judgmental of the parts of them that are acting protectively of them. We help them soften to that with compassion and curiosity to understand the intent behind those protective strategies. Like, that was necessary for them at one time in their life with caregivers who couldn't provide those needs or make that feel safe for them. And now it's showing up in their current life just as if it was still just as necessary, even though they're adults now and maybe they're safer, they're able to take care of themselves. Even if they're going through a breakup or a divorce, they have some independency that allows them to know that they can get through that, but that doesn't register for those parts that are still stuck in these early relational traumas. They still feel like the whole world is falling apart because I've been abandoned, or it's my fault that this person is not able to love me.
Sometimes it's just language, but at the bottom of it, like, we're all talking about the same thing with a different word.
Right.
Just finding metaphors that works for us.
Absolutely. Yeah. It feels like there's nothing new in this, right? It's all sort of taking pieces of different types of interventions or theories behind how we work as humans and bringing it together a little bit differently, packaging it a little bit differently.
Growth is so uncomfortable. At times you can see your pattern, name your pattern, see yourself doing the pattern, and then somehow keep doing it.
I think that again speaks to what gets frozen in the memory and in the nervous system that creates that getting stuck in these patterns of behavior. When we can help those parts of us that develop those strategies early in life recognize that we are safe now, or we do have resources available to us that we didn't have before, like choice, ability to communicate our needs and feelings more effectively, then we help those parts sort of recognize that those strategies, those protective or survival strategies, aren't necessary in our current state. What EMDR is really good at is when we can trace back, right? Like, we identify a behavior, a pattern of behavior that is causing us problems in our present day life, maybe in relationships, and we can trace back to experiences in childhood or early life that contributed to those core beliefs and those protective survival strategies being developed. Then we help those parts process through what happened so that they can get to a different belief. So let's say, for example, being really reactive, thinking about maybe an anxious attachment style where behaviors like being very reactive or kind of that constantly pursuing that comes from typically about a fear of abandonment. Some of the core beliefs that they might have from early relational trauma is things like I'm not good enough or everybody leaves me. And so that's contributing to those patterns of behaviors feeling stuck, because we've got this maybe 5, 6-year-old part of us that decided that that was true at that time based on my relational experiences with my caregivers. And from that developed these protective strategies to keep us from that fear of abandonment or fear of being too much or not good enough. When we can trace back to those experiences that are at the root of that, then EMDR can help us integrate that experience with new beliefs. We can unlock the being stuck in that pattern of behavior when we can come to a new belief. My father leaving when I was 6 wasn't my fault, or I'm worthy of love and connection just as I am. That's where we get that big shift for clients that might be trying to stop some of those persistent patterns of behaviors and relationships. We get those big shifts because now they're able to integrate that new belief about themselves. Somatically, they release whatever was attached to that, like that constant state of fear of abandonment that lives in the body in that way. They release that and they integrate these new beliefs in a way that helps them shift those patterns of behavior.
Why is it that just staying out there doesn't create change, but doing any EMDR treatment, what's the click?
That's where the adaptive information processing theory comes into play. An EMDR trainer, therapist, Tom Zimmerman, uses this idea that you can't attach a lie to a lie. If a person, developed this belief of I'm unlovable. We can't attach that maladaptive thought to a current sense of if that doesn't feel true to me now, then there's no change is going to happen. We can't just say like, oh, I know I am worthy of love and that shift because this part is still stuck in that belief. And it doesn't see that as true. It doesn't see that I am worthy of love as true. We have to build that adaptive information for those clients so that they can, when they get there, right, like through maybe helping them develop internal imagined attachment resources where they get to actually experience a nurturing or protective attachment figure, or they can strengthen their own internal sense of self that is compassionate, that does feel connected, that is able to um, access those qualities that they didn't have available to them when they were younger, then we get that adaptive information that allows the client to effectively take what felt true then and link it to what is true now. And they are able to release that. The bilateral assists in that. It's part of the theory of memory reconsolidation because we get a disconfirming belief, an experience of a disconfirming belief when we bring these nurturing, protective, attuned attachment figures to mind and get that need met that was not met back then. That's where that gets to consolidate in a way that gets it unstuck, not only from the way of thinking about it, but also the emotions attached to that and the somatic experience of it being true. One of the things that we are measuring when we're doing EMDR is how distressing is a memory and what are the negative beliefs about ourselves that are attached to that memory. We're also assessing how true. We ask the client, what would you rather think about yourself now? As you think about that image that represents the worst part of that, what would you rather think about yourself now? And they identify a more positive cognition. And then we measure the validity of that cognition. In the beginning, it'll often be very low, right? Because you can't attach a lie to a lie. Through the process of reprocessing that memory and getting more adaptive information available to them, they'll eventually get to the place where the distress level related to the negative belief about themselves goes to 1 or 0, and the positive cognition, the validity of it increases. Now they've resolved that memory because they can now think of that memory and the new positive belief about themselves feels true.
I have tried to adopt this practice of cross-check my assumptions with my husband. That sometimes I think I see something, hear something, and I create this story, and it makes sense with the greater narrative for life together, right? And then I ask, and he's like, "Oh no, like I don't know, like that was like that's not doesn't exist in his whatever I think he did was my assumption and his intention. Intimacy is being able to go apart and then come back together. I realized that my biggest fear is that once the more intense you're connected, then the more time and space you will need to be able to refill your own energy that you're going to bring to your relationship.
You have this story in your head of what your husband maybe intended. That again, I would go back to polyvagal theory. What that tells me, because story follows state, there's already an internalized sense of anxiety or fear attached to that. I'm going to interpret this based on my past experience and what that would have meant for me then. The state of being already maybe anxious or avoidant in relationships is there because of these past experiences that is going to obviously color our interpretation of the interactions and the story that we create around that. When we're thinking about a fear of abandonment, we're recognizing that there's a part of us that experienced that early in life that's sort of at the forefront. It's the one having these big reactions to cues of danger or threat in the relationship. And as a result, it's going to react based on what was necessary for it, what protective strategies got developed early on, which is, well, fine, I don't need you anyway, or how dare you, talk to me that way, or say that to me, or, see, there you are, you're just trying to start a fight or whatever. Like the reactivity is coming from those protective parts that have that fear of abandonment and try to help us manage it in whatever way was developed early on. Integrating that parts work with EMDR, we might target that particular part that has that story attached to it, And we could do maybe a float back as a process in which we identify the belief that creates that story. Like, I'm too much. If I'm worried about people abandoning me because I'm too much, because my needs are too much, then we would identify the emotions that are attached to that and the body sensations. And then we would ask the client to float back in time and start to identify earlier times where they felt similarly. We ideally want to get to worst experience of it or the earliest experience of it because it's stored in a memory network. And if we can get to the worst or the earliest, then we have a better chance of clearing out some of the other later experiences that affirmed that. That would just be information for me to start exploring with the client. Let's get to know that part that has that story attached to it. When my husband says this, what I feel is him pulling away or him criticizing me or whatever, that sense of abandonment that comes from that triggers that feeling of abandonment. We would explore that, and then we would try to identify earlier memories that might have contributed to that belief getting formed and that behavior of picking a fight or whatever I might do when I feel that fear of abandonment.
I believe that nothing has helped me get to know myself and my story more than being in a relationship, but also having that space to be completely by yourself alone, basically all the time when you're in your space. When they struggle with one relationship, when I do get in a relationship, this thing happened. So I don't want to get in another relationship. What happens if, or I keep getting back to that relationship that I know is not good for me. And it gets better, but it gets so much worse before it gets better. That discomfort of I am starting to build those habits that get me closer to what I want, but my circumstances are the same because I haven't become that person yet. I'm still in the process of becoming. And sometimes we're like, oh, nothing's working, which is kind of okay. So let's just go back to this. I will end up here anyway.
That probably speaks to what might be the person's primary attachment style and how that is showing up in the dating process. A lot of times, clients really want to have a different experience, and they, like you said, go on this journey of trying to change some of their behaviors or their habits. After a period of time, it doesn't feel like they're experiencing anything differently. I really believe in the energetics sometimes of relationships. They might be carrying an energy that they're not really aware of. Because again, I think when we're changing our habits, we're often doing that from the top down approach, right? Like, I want to be thinking about it differently, so I'm going to do it differently. Classic CBT type strategies. I think they miss a lot of times what's the bottom up. Where is this actually stuck in our unconscious state? And even though we're trying to change our thoughts and our behaviors, energetically, we might still be presenting and attracting something that feels familiar to us from these early experiences. When clients come in presenting, again, with a lot of intellectual type things about this, well, I've been working on this for so long and I don't understand why I keep back here, and or this keeps happening, keep attracting these same kind of guys or girls. That's just information for me to see if we can get them more connected with what might be a discrepancy between how you're thinking about things and what your body is saying feels safe. If my body felt safe with conflict and chaos, because that's what I knew growing up, then someone who's showing up is very calm and doesn't want to fight might feel great intellectually. We might think this guy's perfect, but our body is saying, yeah, no, I don't trust that. This is what I know, so this is what we need in order to feel safe. And that is what feels familiar to us. That might be something that is happening that means that, yeah, until we start changing where the body shows up in the relationship and what feels really safe in the body and in the nervous system, we're probably going to keep coming back to those patterns of behavior.
What if the belief is once I get this done, I'll be more confident. I will, whatever it is I need to then start dating.
I might look at what part of us is feeling like it's not ready, that we keep putting these barriers in front of us to start dating. So like, oh, I want to I want to lose weight, or I want to be more confident, or have higher self-esteem, or have a better job, or whatever. I would be curious to explore, okay, what is not feeling safe for some parts of you that we're stuck in this, putting it off, procrastinating it, believing that everything has to be perfect in my life before I'm able to find true love, or before anybody is going to want to be with me. I've got to look a certain way, act a certain way, think a certain way. It would just be information that I would want to explore with someone to try to understand what's at the core of that, and where there might be some early experiences that might be contributing to why that feels necessary, why that protective part is putting this off because it, for some reason, it doesn't feel safe just yet. Always looking to make new connections. Really appreciate you creating this platform and inviting me to come and talk about this work that I love and probably could go on for another couple of hours with you if we had the time.